Good afternoon. My name is Roxana Marina, and we're going to be presenting case number 2 for IPE. I am presenting with Krista Chapa, Abigail Witten, Ashley Hajovsky, Faria Sahada, and Anson Harris. So an introduction to our case. So case number 2 is going to involve the ethical dilemma that is involved in ensuring patient privacy versus maintaining the health of the public. And in this video, we discuss our collective viewpoints as an interprofessional team in order to understand the nuances of this case.
So question number 1 is asking the scope of practice for each individual in the case. The CRNA determines the amount and type of anesthesia required and administers to the patient during the C-section. The obstetrician performs the C-section for the patient and delivers the baby. The nursing team monitors the patient's health prior to and following her delivery. The pharmacist dispenses HAART medication with correct dosing and counsels patient on correct usage and potential risks. The hospital risk manager manages patient information and ensures there are no breaches or risks for possible financial loss to the hospital. And the pediatrician makes sure that the baby is healthy and tests the baby for any potential problems.
For question number 2, personal feelings aside, what role does an interprofessional team have in engaging the parents? So the team is obligated to follow legal guidelines. They need to also ensure the safety of the child, making sure that the child receives the best medical care. They do have a duty to inform the parents of any risks that are associated with HIV. And they also have a duty to minimize the exposure of HIV to the child by, for example, not allowing the mother to breastfeed. They also have a duty to report the HIV case to the public health department, which would include reporting the father's potential positive HIV status. Ideally, they would try to get the mother's consent to tell the father first, but if not, the team would still have a duty to report it.
Public health implications. The major goal is to prevent the spread of a communicable disease, especially one such as HIV, which is potentially deadly. The main goal is to notify affected individuals of potential infection risk, mainly the father. Major goal is to kind of influence her to try and do a self-disclosure, but if that isn't possible or if she's unwilling to do so, go through legal routes to do it. Notifying partners supersedes the patient right to privacy in a case like this. HIPAA doesn't truly apply when it needs to be notified to a partner.
All right, so what are the Texas laws governing prenatal HIV testing and then afterwards when the baby is born? So Texas law specifically requires that in the first prenatal visit, HIV has to be tested for, and also Hep B and syphilis are also part of that screen. And then in the 3rd trimester, you do another HIV test around week 28 or so. And then at delivery, before baby is actually born, you do syphilis and hepatitis B screening. And then another HIV test if the initial 2 HIV tests were not obtained. And then at the newborn screen, HIV is tested in the actual newborn if the mom's maternal status is not known at the time.
Okay, number 5, how should the nurse anesthetist, nursing team, and pharmacist respond if the husband asks what the medication is for? So although the physician is required to report STDs to the public health department, prescription information is protected by HIPAA. So disclosing this information is not allowed without written consent from the patient, which in this case was not given. So ultimately, either the nurse anesthetist, nursing team, and or pharmacist would have to tell the husband that they are not allowed to disclose this information.
So in conclusion, we talked about the scope of practice for each field, the medical team, the nursing team, the pharmacists involved, and we also talked about the role of the interprofessional team as well as public health implications. And we also discussed the Texas laws related to HIV testing, as well as we also just talked about how the nurse anesthetist and nursing team and pharmacist should respond if the husband asks what the medication is for. So this concludes our video for group 19 for the IPE case number 2.